Good afternoon, everyone. This is Marisa Jones from the Safe Routes to School National Partnership. Just wanted to let you know that we will begin promptly at 3 o'clock. Good afternoon, everyone. We are going to go ahead and get started with the webinar, 3 o'clock here on the East Coast. And I see a number of people still joining in, but we want to make sure that we have time to get to all of our exciting content today. So I'd like to start by welcoming you to today's webinar, Policy, One Step on the Path to Walkable, Healthy Food Access. For those of you who don't know us, we are the Safe Routes to School National Partnership. We are a nonprofit organization that improves the quality of life for kids and communities by promoting active, healthy lifestyles and safe infrastructure that supports bicycling and walking. Equity is an essential component of everything that we do. So what is it that we do? We work to improve quality of life for kids, families, and communities. We advance policy change at the federal, state, regional, and local levels. We catalyze support for safe, healthy, active communities, and we share our deep expertise. Before we get started with the content for today's webinar, here are a few housekeeping items on how to use GoToWebinar. To the left is the GoToWebinar viewer, through which you'll see the presentation. To the right is the GoToWebinar control panel, where you can raise your hand, ask questions, and select the audio mode you'll use. Please note that your control panel will collapse automatically when not in use. If you would like to keep it open through the duration of the webinar, you can click on the View menu and uncheck Auto Hide Control Panel. You have two options for listening in today. You can use your phone or you can use your computer's microphone and speakers. If you have sound problems with one selection, give the other option a try. We'll do our best to field any issues that you're having. Just go ahead and send us a chat message in the control panel. All participants are muted, but even though you're muted, we still want to hear your thoughts, your feedback, any questions that you have for our presenters. You can use the question box in your control panel to ask speakers questions during the question and answer portion of the webinar. We have left plenty of time today for questions, and we'll take some time to answer those at the end of the presentation. After viewing today's presentation, you might want to view it again, or might want to send the link to some of your partners or fellow organizations engaged in this work. If that's the case, you can do that for free by going to saferoutespartnership.org, clicking on the Resource tab heading, and clicking on Webinars in the list on the left-hand side of the page. All of our past webinars are stored here for your viewing pleasure, and they are great resources, so I urge you to visit this page. And now we will go ahead and get started. I'll provide more in-depth bios of our speakers before their presentations, but we're really delighted to welcome Mike Zelich, who is the Health Promotion and Policy Division Director at the Chatham County Public Health Department, and Barb Nee, who's a transportation planner in the city of Asheville, North Carolina. So let's dive into today's content. We are here to talk about policy, one step on the path to walkable, healthy food access. So what we really want to do today is talk about how public policy can be used to improve walkable access to nutritious food. At the Safe Routes to School National Partnership, we work to make it easier and safer for people to walk and bike throughout their communities. We focus on schools, parks, and other important community destinations, like grocery stores. We refer to our work to make it easier, safer, and easier for people to walk and bike to healthy foods as Safe Routes to Healthy Foods. Over the past 2 years, we've led a national work group in partnership with the Food Trust and funded by the Voices for Healthy Kids initiative that develops recommendations on how to support safe, active travel to the places that people buy and obtain food. So before we dive into some of the solutions, let's make sure we're all on the same page. What do we mean when we're talking about safe routes to healthy food? And what are policies to advance walkable food access intending to fix? Well, for starters, in too many neighborhoods, local stores carry no fresh produce or other healthy options, or there are no stores nearby. Without healthy foods close by and without a private vehicle, getting to healthy foods is dangerous and inconvenient due to unsafe walking conditions and lack of access to public transit. Almost 20% of people in the United States experience significant transportation barriers to accessing healthy foods. We do this work because we want to support multimodal mobility to important community destinations, and ensuring walkable, bikeable food access is an issue of equity, safety, and health. So let's talk a little bit more about each of those things and dig in a little bit more into why this work matters. At its core, this work is rooted in social justice. Everyone has to eat. It's not an option to go without food. Whether people shop at a supermarket or a corner store, access food at a food pantry, order takeout or pick up produce at a farmer's market or community garden, everyone needs a safe and reliable way to get to the places where they obtain foods, ideally healthy foods. Not everyone has a car, and many people rely on walking, bicycling, or public transportation to access food. All people deserve a transportation system that can conveniently, safely, and affordably link them to the places they need to go, especially to healthy food. There are other benefits to ensuring walkable, bikeable, healthy food access too. Research shows that people in neighborhoods where destinations are located within walking distance from residential areas and where street features make it safe and appealing to walk are more likely to be physically active and less likely to be overweight or obese than those in less walkable neighborhoods. Studies show a positive correlation between access to healthy food retail outlets like supermarkets and better health outcomes, including lower BMI, body mass index, and lower rates of obesity. Working on improving functional connections, like to grocery stores, has an added benefit. Many of the solutions that make it safer and more convenient for people to walk, bike, and take transit to healthy foods also make it easier for people to get to work, to parks, to schools, and to other places that they want to go. An additional benefit of improving opportunities for people to walk and bike to access nutritious foods is that it also creates more and safer places for people to engage in recreation and to be physically active for fun. It can also be good for economic development. Research suggests that improving pedestrian and bicycle infrastructure in commercial areas, such as walkways, bikeways, and bike racks, can increase sales and economic activity at local stores. So now that we've talked a little bit about the need for and the benefits of safe routes to healthy food, let's talk more about how communities can work toward achieving them. So 2 of the key opportunities for working towards safe routes to healthy food where you live or where you work are planning for healthy communities and adopting policies that promote multimodal mobility. A key role of local governments is to plan how development, transportation, and investment can help a community achieve its vision for the future. In developing long-range planning documents for communities, local governments have the opportunity and responsibility to envision and plan for a place that lets everyone access physical activity and healthy food. Communities are increasingly seeing the importance of taking steps to create a transportation network that lets people get around by a variety of modes. For walking, bicycling, and taking public transportation to be viable and reliable alternatives to personal vehicles, jurisdictions must consider both the routes that people travel and the destinations that they travel to. Since all people need to eat, considering how people get to grocery stores, farmers markets, and food pantries is an effective way to promote a strong multimodal transportation system. There are countless programs and practices that can be used to advance safe routes to healthy food, but today we want to focus on policies and plans. Why is that? Policies and plans set the framework and vision for how our communities develop, and ultimately what they look like and what they feel like as we move about them. State, local, and regional policies have a profound impact on the safety, convenience, and ability of people to be able to walk to important community destinations and be more physically active in daily life. Research on how zoning codes and land use plans and policy impacts our ability to walk in our communities and to access nutritious foods shows that these policies and plans really do have an impact on people's ability to walk or bike and access nutritious foods. This is research from Bridging the Gap, which found that lower and middle income communities are less likely than higher income communities to require pedestrian-friendly improvements, active recreation areas, open space, trails, and bike lanes in their local land use laws. And relatedly, lower income communities were significantly less likely to allow supermarkets or grocery stores than were higher income communities in their local land use plans and zoning codes. So with that, I'm excited to turn it over to our speakers. I will first introduce Mike Zelich, who is the Health Promotion and Policy Division Director for the Chatham County Public Health Department, where he has worked since 2012. In this role, he oversees initiatives focused on building healthy and equitable communities where all residents have access to the resources needed to live healthy and fulfilling lives. Originally from Nashville, Tennessee, Mike came to North Carolina in 2010 to study health behavior and health education at the University of North Carolina, Chapel Hill. Before that, he worked with a nonprofit organization in northern Nicaragua for 3 years, where he led health initiatives and taught English. Take it away, Mike.
All right, thanks, Marisa. Thank you all for having me. And as was mentioned, my name is Mike Selleck. I'm here in Chatham County in North Carolina at the Public Health Department. And we're really passionate about work in partnership with our planning partners. And one of the projects that really kicked us off in this work happened a few years ago with the town of Siler City in Chatham County, specifically focused on the pedestrian master plan, and that's what I'll be talking about today. So for those of you who don't know much about North Carolina or Chatham County, that's where we're located, right in the middle of the state, the triangle region there, and that blue star represents the town of Siler City on the western side of the county. Looking at where we really are in terms of the data, in terms of our health issues, obesity is the top health priority in the county. That's according to the 2014 Community Health Assessment. When we look specifically at the town of Siler City, we notice a lot of those socioeconomic barriers that can lead to poor health outcomes. For example, you see here the difference between the town and the county in poverty rates, 28% for the town, 12% for the county. When you look at per capita income, Siler City is under $14,000 and Chatham County is over $35,000. You see the disparity there, and that's why a lot of our efforts involve this partnership with the town to improve the conditions in which people live to help them lead healthy and productive lives. Looking more at demographics of the town, about half of the residents identify as Hispanic, and that's among the highest Hispanic populations of any town in the state of North Carolina. We also have barriers in terms of access to things like recreational facilities in the town and what we'll talk about today, healthy food options. And I want to highlight that while obesity is our leading health issue, you all know it's not unique to Chatham County. The obesity epidemic is countrywide, and our rates are more or less in line with a lot of other counties out there, but it's still a big enough issue to be a top health concern of ours. So when we talk about something as complex as obesity, what we need are these innovative and diverse strategies, and especially cross-sectoral partnerships to tackle problems. These are complicated. They have many things that lead to them coming out this way, like a higher obesity rates, and they require broad partnerships and broad approaches to address them. So in 2013, we were embarking on this healthy foods assessment. It was something that we thought would have a lot of value to our work, and we recruited a couple of, at the time, UNC students to develop an inventory of stores in the county with healthy food options, and we saw that as a real opportunity to guide our work. And so what they did was they created metrics to rank the food stores in the county based on their availability of healthy food options. So you see the ranking scale there at the bottom. We had two kind of criteria. If you could make a My Plate with all the ingredients, if all those ingredients were available in the store, and the variety of fresh fruits and vegetables. And so at the bottom of that, you see the green plate. That would be a store that has all the components of a My Plate and at least 5 different types of fresh fruits and vegetables. And so those would be like those top stores. And overall, we surveyed 82 stores across the county. And here you see a map that they created to show where those stores are located. So you see them concentrated northeast Chatham. This is the kind of Chapel Hill, Cary, urban sprawl there. And so you see a good number of healthy food stores there. And then as you move south from that, there we go. You'll see the town of Pittsboro, where I'm located, is pretty densely populated with stores with healthy foods. And then you move west is the town of Siler City, straight along 64 there, about 20 minutes west of Pittsboro. You see the town of Siler City, and also a mixture of food vendors, but a higher concentration than in a lot of those rural areas around them. So at the time we were doing this healthy food assessment, we were getting to know the town staff of Siler City, and I was pretty new to the health department, and we were at a meeting and we realized that the new town manager was talking about their process that they were getting underway to develop a pedestrian master plan. That was exciting to us. We had some grant funding that could support incorporating health into town plans. It wasn't something we had done before. And so we got to talking with them, and we met with the town staff. We met with their consultants, Alta Planning and Design, to see if the public health department could help strengthen the plan and put some health resources towards it. And as it says there, we're really looking at new ways to incorporate health into the plan. And when we looked into other pedestrian plans from across the country, we didn't see a ton of new health strategies to really promote health in the plans. And so we were looking into doing new things. But what we didn't know is, hey, we had this healthy food inventory that was being developed, and the town was working on this pedestrian master plan, which they'll tell you was, they were kind of going with the default plan. There's more or less a template that's needed by the NC Department of Transportation to prioritize projects. That's what they were going with. We had this healthy food store inventory, and this was a great opportunity for synergy and to combine our efforts, 2 ongoing projects into one, and with the goal of making Siler City providing more safe places to walk and improve access to healthy food. So this is really simple, and I want to kind of get across it. We were already doing the healthy food store inventory. That was something that was ongoing. We were just combining this with what they were already doing. And so it wasn't a whole lot of extra work on our part or their parts. It was just a way to strengthen both of our processes. And so there you see the town of Siler City's pedestrian master plan came out in 2013. Here's the town of Siler City, a map that looks similar to the counties, but specific to the town of Siler City. There are, you see the different food stores there. There are 8 top-tier healthy food options there, those green plates kind of dispersed across the town. This map shows potential connections to healthy food vendors. This was something that the consultants developed, and basically looking at proposed projects, sidewalks, greenways, and how that related to or could potentially improve access to these food stores. I think a really cool analysis and exciting to see, basically healthy food being incorporated into a process that they had ongoing. And how that plays out is here on this next slide. You see the different neighborhoods in Siler City and the distance, their distance to these top-tier healthy food stores. And so they were specifically highlighting the stores within a mile or less than half of a mile from these neighborhoods and saying, hey, is the pedestrian infrastructure there built appropriately? Because this is a distance that presumably somebody could walk. This is a town with a high proportion of zero-car households, and you see that on the prioritization criteria. And so pedestrian access to basic necessities of life, like healthy foods, is really important. And so when you look at those neighborhoods, what options do we have in terms of distance to maybe strengthen the pedestrian infrastructure to improve connectivity? And then on the right, I think this is where the rubber meets the road, so to speak. You see the different criteria that we had a steering committee looking at different criteria to prioritize pedestrian projects. And so at the top of the list, probably not too surprising, reported pedestrian crash locations. I don't think many would argue that that's not an important thing to prioritize projects on. But if you go down the list in that red box, you see direct access to healthy food opportunities. And so we're saying here it's not the most important issue, but it's something that should be considered when prioritizing these projects. And so that was just really unique to see and really cool for us to work with them, and the town was getting excited about this. Hey, we're considering healthy foods in this. We had never thought of this before. And that was something that meant enough to them that it made its way up the list a little bit. And it combines with other health-related issues like park or recreation center proximity, as I mentioned, low vehicle access areas, or limited English proficiency when you really get to the equity piece of it, and then going on to high disease rate areas. So really a cool process to see how prioritization played out and having access to health foods as a component. I also mentioned recreational opportunities were considered as well, a similar analysis as the healthy food options, and here you see a similar map showing connectivity to the different parks that exist in the town. So what are the big benefits, the big takeaways from doing this work? Well, the big thing is that we're able to work together to advance our goals. We want a healthier town. We want to address Chatham's priority health issue like obesity. And the town wants to create a healthier environment and one that fosters people walking to places. And so this was a way for us both to work together to advance our goals. And really, as I mentioned before, these were existing projects for us. We were doing the healthy food inventory. They were doing the pedestrian master plan. And so we combined those and we added value without taking on a completely new project, but we were able to complete one using existing projects. It's always great when we can foster town-county relationships. That's something that benefits our future work, and they're relationships that aren't always there. And so anytime we can work together and strengthen our relationships, that can lead to important partnerships in the future. So what are some of those partnerships? Well, the town, out of the project, maybe a year later, worked on a project to construct ADA compliant curb ramps in downtown Siler City, and we were able to use some of our grant funds to support that project. That was a prioritized project out of the pedestrian master plan. So they weren't letting this plan collect dust, they were implementing it right away, and that was really exciting to see. Maybe a year after that, we worked on a Safe Routes to School project with them at a local middle school, and that was a big partnership between the county, town, and schools. From the healthy food access standpoint, we piloted a healthy tienda project in Siler City tienda. And a couple years ago, we worked with them on a parks master plan, and that was another exciting way to incorporate health into a plan that they had underway. Funding, people want to know, well, did they actually get money out of this plan? Were they able to implement projects because of what they did? And they were able to develop a project list for Spot 3.0. I think that's some like NCDOT speak for what you need to get money to support your projects. And this was really exciting. The second bullet point, which we're still kind of blown away by, last year the town submitted 3 projects that were recommended in the pedestrian master plan, and our region had room to fund 3 projects, and they were all 3 from the town of Siler City, which is just almost unheard of. And I talked to them, and they thought there must have been an error when that happened. It just showed, how much these plans can mean to a small town of about 8,000 people. It's really exciting stuff. And that's kind of what you see on this next slide. The town has just really pushed the envelope to expand what they're doing. They've gotten funding to support a number of initiatives, and under transportation, you see a lot of those related to pedestrian stuff. So the ADA crosswalk projects I mentioned, Highway 64 improvements. There are a couple stores with healthy food options on Highway 64, and a lot of that $10 million went towards pedestrian infrastructure, and then various sidewalk projects that even one that's close to our clinic and our FQHC and community mental health providers. So those return benefits back to us. We're able to get people walking. We see a lot of issues, clients saying they miss their appointments because of transportation barriers. So providing that infrastructure and improving that infrastructure is good for us and good for the healthcare system as well. And then the town manager mentioning here at the bottom that securing outside resources to make these projects possible could not be done without strong partnerships with Chatham County and others. So that just shows how important it is for us to work together. We've continued to work on a number of planning projects. This was the first of many, and you see another one in Siler City. We've had a seat at the table, public health, at every plan that's come out of the county and its municipalities since this project. All 3 municipalities, Town of Goldston, Siler City, and Pittsboro. And the big one there at the bottom that we were excited about for a long time, the Chatham County Comprehensive Plan, which is a guiding document for the next 25 years in our county, which is expected to have some pretty big growth in terms of plan development. Out of the last community health assessment, we started our coalition, the Chatham Health Alliance. Given some of the stuff we'd already done, we received a Duke Endowment grant to support our work. We recently received the Healthiest Cities and Counties Challenge. We were recognized as one of 50 communities across the country to participate, and a big reason for that was our work with the comprehensive plan. And that plan also led to us being recognized with the Spotlight Award through that same project that recognized 10 communities across the country. Siler City has also received a lot of recognition, including the 2015 North Carolina Rural Center Small Town of the Year Award. And there you see a news release about the comprehensive plan, which I'd encourage you all to check out. It has a pretty big health element that was really exciting for us. So if you're looking to collaborate, public health and planning, what do you need to know? Well, you need to get to know each other first. You need to know who you're working with and who your partners are. Find those mutual goals. It's always good to have resources and financial support. Certainly got us in the door, and people know that, hey, maybe the health department has some grant funds that they'd be willing to allocate towards these projects. I really see planners as public health practitioners. When we're talking about the built environment and all those structural determinants of health, planners are working on it on a day-to-day basis, and we really need to include them in the work that we do. And I think that, the partnership between planning and public health can strengthen our separate projects, and we come to mutual projects and open new doors to new resources. So I'd like to thank, of course, the town of Siler City, who are great partners, and their planning department, our UNC grads who worked on that healthy food vendor inventory, the consultants, Alta, and 2 grants we have, a community transformation grant, which is no longer there, but healthy communities remain. So thank you all for inviting me, and if you have any questions, I'll be around at the end. Thank you.
Thanks so much, Mike. Really appreciate you taking the time to share your experience with this work, and especially getting to see how that has had an impact in the town of Siler City. I think that is so remarkable that they received funding for all 3 of those pedestrian projects that they applied for. So thanks so much for highlighting that. I'm excited to turn it over to our next speaker, hailing from a little bit west of where Mike is right now. Barb Mee is a transportation planner and serves as the City of Asheville's pedestrian and bicycle coordinator. In that capacity, she works with a variety of groups and individuals to make Asheville a place where everyone has a range of good transportation choices that include comfortable facilities for walking and biking. She's a strong believer that we go further, faster, smarter, and happier when we work together to achieve shared goals. Asheville has been awarded the designations of Silver Level Walk-Friendly Community and Bronze Level Bicycle-Friendly Community, largely because of the work done by and with active transportation advocates. Barb is a graduate of Appalachian State University in Boone, North Carolina, with a degree in Community and Regional Planning, and is a member of the American Institute of Certified Planners. Turning it over to you, Barb.
Okay, thank you, Marissa. Thank you all for being here today and inviting me to come and talk. Asheville has a neighborhood sidewalk policy, and you might find yourself going, neighborhood sidewalks? What are those? And in Asheville, they're sidewalks on local streets or collector streets, which are the streets that get you out of your neighborhood. On those streets, they're residentially zoned properties. And that's really because if you are trying to fund projects, and you saw from Siler City, you can get some really cool grant money that leverages your own community's money. And so from my perspective, I kind of have to go after that. But these sidewalks really aren't big enough or don't fit the right requirements, and they were sort of fallen by the wayside. And our city council said, this is important to our community, and it's important enough to us to establish a separate budget for these kind of sidewalks. And so we set about first creating a policy, because as most of you have probably already learned, when you have a policy, it helps making those choices easier. We developed the policy in cooperation with members of our city's Multimodal Transportation Commission and Neighborhood Advisory Committee. And both of those groups are citizen volunteers appointed by our city council to advise them on particular issues. Much of the analysis was done on a GIS platform. You can do it by hand, but boy, do computers and people who know how to run them make it easier. And we had 2 levels of consideration built into the policy. I called them here theoretical and practical. I'm not sure those are quite the right words, but is this the best choice out of all of the choices that are possible? And then that practical question of whether we can build it. As we do in virtually everything here in Asheville, the process included community input, and I sure hope it reflects our community values. Collecting the data, I was asked about that, and you need to use what you have or what others can produce. You can get a lot of really exciting data ideas, and if we can find this out, and then we can add that, and then we can do this. But remember, you either have to find it or build it. And then once you have it, you have to use it and maintain it. So sometimes the exact thing you're looking for isn't quite available, or you don't have somebody who can maintain that data, or the data points. Like for us, we've thought about doctors' offices. Those change a lot. So I would suggest, there's a list here on the slide that I don't need to read to you, but the last one in the first group is open data sites and code for your town. Here, there's an organization called Code for Asheville. I believe they're a subset of Code for America, and these are really smart computer people who can help you develop applications and ways to do things. I encourage you to take advantage of them. The policy itself expresses our priorities. Residential density, we expressed by zoning districts that are residential, and are they multifamily, are they single family, are they spread apart, are they close together? Safety, we used pedestrian crashes and traffic volume. Equity, we expressed as prevalence of low-income housing and zero-vehicle households. And we also talked about proximity to transit stops and parks and recreation centers and libraries and schools and major grocery stores. And these are all things that open up your world. If you can walk to the transit stop and you can walk from the transit stop to the grocery store, suddenly you have a lot more options, some of them much more cost effective than others. This is kind of all at the intersection of local values for us in Asheville. Access to healthy food is a community concern. As Mike talked about, our local public health folks helped me learn that you want to include health in all policies, or at least the public health folks want you to, and I certainly advise it. And they are great partners to work with. Asheville has a very complete streets, multimodal approach to transportation. Our neighborhoods are very important to us. Active transportation is important, as is equity. And we have a great foodie community. We have some amazing restaurants and amazing chefs with an amazing amount of heart. A couple examples are the welcome table at one of the downtown churches that I think most welcome tables welcome you with cloth tablecloths and real silverware and real plates. But ours also welcomes you with the occasional James Beard nominated chef cooking today. And we have another place in town called 12 Baskets, where your lunch will be provided by restaurants from various parts of town. So these are folks who have a heart, and who understand that getting to fresh, healthy food is really important to a happy life. We also have an edible garden, and we are creating an edible mile on our Greenway, where the vegetation will be things like blueberries and raspberries, maybe off the road, but raspberries and trees that bear fruit, so that those will be available to anyone who wants them. I know I'm a little early in the process here. I had 15 minutes and I've only used a portion of that, but I want to be able to get to questions if folks have questions about this. And I certainly appreciate you being here and being interested in the topic.
Great. Thanks so much, Barb. Really appreciate you sharing the neighborhood sidewalk policy in Asheville and how that takes into account local priorities like healthy food access. And that is really neat to hear about the edible mile. I'm going to be very interested to learn more about that. So want to invite people to go ahead and ask questions. We have several questions already in here, but want to open up the opportunity for people to ask more questions. And I just want to kind of tie together this presentation from Barb and from Mike. These are really great examples of how cities and towns have been using policies and plans to make it easier for their residents to walk to healthy food access. And one of the things that I heard from both of you is that it really reflects the priorities and the values of your community, and that partnerships are a very essential piece of this work. So that's really great. I also want to share a couple of the recommendations that our organization's Safe Routes to Healthy Food Task Force has compiled, some of the different policies and plans that can be used by communities to improve walkable, healthy food access. And so a couple of those are long-range plans. So as Mike mentioned with the pedestrian plans, thinking about how you can include health, active transportation, and healthy food access as priorities in long-range plans is one way to go about this. Touching on the research that I highlighted from Bridging the Gap research, communities can update zoning codes to promote connectivity of destinations and require supportive infrastructure for walking and bicycling, and also expressly allow healthy food retail as a permissible use. Complete streets policies are another great opportunity. I know Barb talked about how in Asheville, they take a complete streets and multimodal approach to transportation planning. And one idea for how to specifically include healthy food access in your community's complete streets approach is in the implementation section of the policy. Do something similar to what Asheville did and use healthy food access as a criterion for project prioritization and funding. A couple of other examples that we didn't so much talk about today are active design guidelines. So developing active design guidelines, including healthy food access considerations, and there are a number of examples of those from across the country. Planning for transit-oriented development. So Barb kind of alluded to how connectivity to transit and being able to walk to a grocery store really opens up a whole new world of opportunities for physical activity and for healthy food access. So making sure that when you're planning for transit-oriented development, that food access is a part of that development. And we know that grocery stores are often great anchor institutions. And then also providing incentives. So developing incentives for developments that support people walking, bicycling, and taking public transit. And so those are just the very high level suggestions. We have more details about all of those suggestions and more, as well as examples of communities across the country where those strategies have been used to link walkable, bikeable, walking and bicycling to nutritious food access. And you can access that those recommendations on our website, which I've linked to at the bottom, and I'll also put into the chat box. So the resource that I'm talking about here is called Safe Routes to Healthy Food, Strategies for Local Governments, but we also have a number of other resources available to help you make the connection between active transportation and healthy food access, including specific resources for working with your local transportation agency. So with that, I want to open it up for questions. I know we have a number of questions that folks have already asked. So at this point, Mike and Barb, you will both be unmuted. So one of the questions that has come in is, our organization is a part of a coalition working on obesity prevention, and we have two work groups, one on healthy eating and one on active living. How would you recommend that we move forward to incorporate healthy eating into our pedestrian plan or local sidewalk policies?
I think that's a really good question. I guess I'll give it a start because we have the Chatham Health Alliance has a similar structure. We have an obesity subcommittee with working groups. We have one on the built environment, so it's helped us. That's kind of where we house some of our planning initiatives, but I can see when you kind of separate them, which is how we initially went into it with food here and exercise here, how it would segregate it. But I think getting those two groups to talk together and realize, hey, these, you may be able to come up with a strategy that helps address both issues, and one like we talked about here is a good option. So I guess maybe have a joint meeting of those two working groups, see how you all can collaborate. If there's enough push to work on planning issues, maybe you're like us, you create even another working group, which I know can be a lot to take on, that focuses on planning and built environment.
I think Mike covered it all, basically.
Great. Okay, we have a lot of questions about the edible mile, Barb. So we've got people who are wondering, somebody is just wondering, can you explain what the edible mile is? And then somebody else who's curious about who is responsible for maintaining the edible plants.
Now I'm going to have to admit that I've only danced with some of this information. I haven't gone steady with all of it. But our edible mile is along a greenway. Before we even considered this, and we are still implementing that. That's the greenway we are building. But before that, we've had an edible garden that Bountiful Cities is a community organization, and they have maintained it. The edible mile, this is where I have to, as I say, I haven't gone steady with all the information, but I think our greenways have a lot of advocates and fans, and I think a great deal of that maintenance will be done by those folks. And we're also choosing native plants as much as possible so that they require less of people.
Great, thanks so much. And I will also add in, for folks who are interested in things like edible miles, on our website, the Safe Routes to School National Partnership, we have a post about the edible greenway. The name of it, specific name of it, is evading me right now, but in Palmer, Alaska. So they planted edible foods along a multimodal path. So you can learn more about that. We did a blog post on it. And then there's also an edible landscaping along I forget the exact name of it, trolley trail in College Park, Maryland, for those of you who are looking for other examples of the co-location of edible agriculture and multimodal paths. So I'll put the names of those into the chat box too. Okay, so we have a question specifically for Mike. Somebody is asking how the stores were, how did you choose the stores that you completed the My Plate survey in?
Yeah, that's an easy one. We went to all of them. So it's the benefits of maybe being in a smaller county that we had 82 that we knew of. We knew the county pretty well, so we were able to get most of them just by, just from what we knew and talking to people who have lived here for a long time. We looked at Google Maps, and the students really plugged away on that. And then we went to every one that we knew of, and that included your corner stores, gas stations, produce stands, all of those things as well. In Siler City, it's more the corner stores, tiendas, and supermarkets, but countywide, it was broader than that.
Great, thanks. Another specific question for Barb. How long ago was the neighborhood sidewalk policy adopted?
It was adopted in fall of 2015, so it hasn't been all that long.
Got it. Great. Thanks. Okay, this is a question for both of you. Were there any messages? Okay, this person's wondering, how did you pitch this to decision makers? Were there any specific messages that resonated to get them on board with this integrated approach?
I think, at least in Asheville, it's an approach we've been taking. And even at the level of the my little advisory panel, we had folks from our multimodal transportation and from our neighborhood advisory committee. And it's also nice that those people then become champions for your policy and what you've developed.
Yeah, I think that's great, and I'll add that when we went to these partners, I think going and saying, hey, my name's Mike. I work with the Public Health Department, and we have some grant funds that may be able to support your project, was a pretty effective way to start the conversation. So if you're fortunate to have those grant funds and you're willing to allocate them to support plans like this, a lot of people perk up when they hear that, and that certainly got us in the door with all those projects. I think we had a little bit of grant funds. But even if you don't, you may be able to cite what other communities have done, and like Siler City, they've gotten a lot of funds coming out of their pedestrian plans. So even if you don't have them on the front end, you might get them on the back end.
Great, thanks. Okay, so we've got another question from somebody who says, we have worked on policies and plans, but they don't get implemented. Any advice for ensuring implementation?
One of the things that I always tell people is that as a community, as a city, it's a lot like just at your own home. You have wants and you have needs and you have resources. And your resources usually don't cover all of the wants and needs. And so you have to decide what's important. And a budget is a policy document. And so it's important that your elected leaders who create those budgets understand what is important to you as the people they represent.
Yeah, I think that's a great point. And I'd add with Siler City, I think they really needed this pedestrian plan to qualify for those dollars, and though creating it was just a step in the process, and they've hit the ground running. I give them all the credit there. They've really worked hard to implement it and have been able to get some resources. And then when we go into something big like the Chatham County Comprehensive Land Use Plan, I mean, just there are so many stakeholders at the table there, and I think going in and knowing this is it has to happen. That implementation kind of has to happen from the beginning of the plan process. I mean, if it's hey, we got to create a plan, and they don't you don't really know where it's going or anything, it's hard to imagine that getting implemented. But if throughout the process you're thinking about not only what we want but what's feasible, then that helps get it accomplished. And it's not always going to be perfect, and it relies on a lot of partners, and it's not always going to happen day one. But if you go in the planning process with the mindset that this is going to be a guiding document, then maybe it has a little bit of a better chance of being implemented.
And there's a report that Federal Highways did. I'll try and copy I don't know if I can, but I'll try and copy the web address into the chat box. But it's called A Resident's Guide for Creating Safer Communities for Walking and Biking. And it's been a while since I read it, but I think it's got stories from various communities and how they made the progress they made.
I love that you just referenced that, because I was actually just rereading through that this week. And they do have great resources and examples, so I'm so glad that you brought that up. That's a great suggestion. So I think this is a related question. Somebody is asking, so they said, Barb, I think you mentioned community being involved in the development of this policy. Can both of you talk about how you engaged community residents in the development of these plans and policies?
We did. Our neighborhood advisory committee has an annual Festival of Neighborhoods, I believe it's called. And they allowed me to have a table at that event, and we did some surveys, and then we did some online surveys and some special outreach to get to folks like to transit riders and other small groups like that, or focused groups like that, along with working with folks on these advisory committees.
And we, Siler City knows more about like the steering committee, but that was made up of town residents. So there was a survey as part of that process, and then going into the other plans like the comp plan, having a good representation on the steering committees, so that the communities really reflected. They had open meetings, and they had these great community kind of conversation settings where they put up displays of the different issues and allowed residents to go through and read and learn more and share their opinions through one of those kind of like dot voting processes. So public health does a lot with surveys and a lot with community input. And so if you're a planner and you want to get the community engaged, I'd imagine reaching out to your public health partners is a pretty good way to do that, because like for us, we're right in the midst of our next community assessment now, and we're knocking on doors or on a random sample of the county. So we do that, and it's something that public health has done for a long time.
Mike, as a public health person, I know exactly what you're talking about when you say the DOT surveys, but can you maybe explain that for people on the phone who have not had the joy of participating in that type of prioritization process?
Sure, and I have to give the credit to our planning department on that one because they did it, but we've used it too. So just if you have the different issues, say transportation, and it may be more specific than that, and healthy food access, and these different things, and you want to know when you're talking to your community what matters most to you, put a green dot next to the issue that you think matters most to you, or maybe a red dot where you don't think that the funds should be allocated, so that you go in at the end and you kind of tally up the dots and see a rough guide of what the community members think.
Thanks. Another specific question for Mike. So somebody is asking, how do you get stores to commit to participate in the initiative? So can you talk about, did stores, were they actively participating in the My Plate survey, or was it that students were conducting an assessment of the nutrition environment? Can you just talk a little bit about the role of stores in this process?
Yeah, that's a really good question. The students really led the survey. In a smaller store, if they were really interested, they might have been more hands-on, but the students at the time, they had developed their survey from, I think, two tools, the Frost and NIMS, if memory serves me right. They kind of combined the two. And so they were really just walking around and doing inventory. I think it's really important that they say who they're with and what they're doing, so it doesn't just look like two people awkwardly taking notes in their store. But I think all the stores were receptive to it. And once you kind of say, here's what we're doing, it's really nothing. You're not in trouble or anything. We're just trying to get a better gauge as to what the healthy food availability across the county looks like. Getting them on board with a healthy corner store initiative, now that's a different process, and one I think takes a lot of time, and I'm sure out there have had more success than we have on that.
Got it. Great. Well, thanks so much. We had a lot of questions. I'm sorry we did not get to all of them, but really appreciate everybody's thoughtful participation in this. Really want to thank Barb and Mike for their wonderful presentations. I also want to remind everyone that we will have this webinar posted online within 48 hours on our website at saferoutespartnership.org. So if you missed something, want to go back to it, if you want to share this with organizational partners or friends, or just watch it over the weekend, you can go find it on our website. We're also going to be sending you a very quick survey. We would really like to hear your feedback on today's webinar. As a national partnership, we really do read what you fill out in these surveys, and we use this information for our future webinar planning. So please take it. It's quick, I promise. And then I also just want to flag for everybody that our next webinar is coming up soon. It will be held on April 11th, and we'll focus on street harassment on the walk to school. So you can look for the registration link in our follow-up email. And with that, again, just really want to thank Mike and Barb for taking the time to share their experience and their wisdom with us, and really appreciate all of you for taking the time to join us this afternoon. We hope to see you again on a future webinar. Thanks, everybody. Take care.